trend? Well, to answer your question, yes, cigarette smoking among senior high school students is a worrying trend that poses serious health risk. But before that, let me greet our dear panelists a good afternoon. Good afternoon, Mrs. Rosales. Good afternoon, Mr. Maninko. And good afternoon, Mrs. Patilia. I am Cassidy Zilana, and let me introduce you to my co-members, Jaimito Gabriel Kawayan, and Miss Diana May Tanza, Kylie Galano, Miss Philceline Tabura, Miss Gia Trisha Quizon, Mr. Iman Tanza, and Mr. AJ Galido, and lastly, Mr. Dale Dominic Mwanya. So, let me introduce you to our research title. The prevalence of cigarette smoking and ways for intervention among senior high school students. From the title itself, we can see that there are two variables, the dependent and independent variables. Prevalence of cigarettes, the dependent one. It is the frequency or proportion in which a senior high school student engage in cigarette smoking. And the independent variable is ways for intervention. This is the strategy in which we can help to lessen the seriousness of this problem among the population. But let me introduce you about cigarette smoking. Smoking is a leading cause of preventable deaths worldwide, killing more than 8 million people each year, according to World Health Organization, which is clearly a need to do an intervention. Senior high school students, on the other hand, are a vulnerable group who are in the process of developing their attitudes, beliefs, and behaviors, and early initiation of smoking increases the likelihood of becoming a regular smoker. So, in this age, this is the time where we are curious about things. For example, the peer influence. Students can have a long-lasting impact on their health and well-being, making them an important target group for smoking prevention. This study aims to investigate the prevalence of smoking among senior high school students and develop effective intervention strategies to address this issue. And the ultimate goal is to improve the health and well-being of young people by reducing smoking rates and preventing negative health outcomes associated with smoking. The study's findings may inform policies or programs aimed at reducing smoking rates, contributing to a healthier population and a reduction in healthcare costs associated with smoking-related diseases. Our related literature to be discussed by Mr. Kawayan.
So, in our related literature, it talks about how cigarette smoking chooses no gender or age. And nicotine, according to smokefree.com, is the main culprit of smoking addiction through various situations. That is because nicotine is a dangerous and highly addictive chemical. One common factor why people smoke is because of peer pressure. Peer pressure, or in other words, friend influence. As a way of rebellion or just aesthetics without knowing the consequences. That is according to the American Lung Association. In our related studies, its content study about the dangerous health issues that you can get from smoking, especially in the senior high school level. It also identifies the factors that contribute to smoking, like peer pressure, low academic performance, parental smoking, and substance use. Thus, effective interventions is a must in this matter. Interventions such as addressing mental health problems and increasing social support. which is seen as effective in reducing the rate of smoking of high school students. Despite that, there are positive declines of smoking in senior high school students on the past decades. It still poses as a threat globally.
Thank you so much, Mr. Kawayan. And to support our related literatures, we have our theoretical framework that discusses the prevalence of cigarette smoking among senior high school students and explores ways to intervene using three health behavior theories. First, the social cognitive theory. It proposed that interventions should focus on increasing knowledge, self-efficacy, and outcome expectations and modifying the environment. The second theory is the social learning theory, which suggests that interventions should focus on changing social norms, providing positive reinforcement, and increasing self-efficacy to resist peer pressure. And lastly, the health behavior model. It proposed interventions in increasing perceived susceptibility and severity, promoting the benefits of non-smoking behavior, reducing perceived barriers, providing cues to action, and increasing self-efficacy. These theories offer a comprehensive approach to understanding the factors that influence among smoking behavior and designing effective interventions to change smoking behavior among the population. Based on the statement, the possible hypothesis for the research on prevalence of cigarette smoking, it would be implementing a school-based tobacco prevention program that includes education on the risk of smoking, skills for resisting peer pressure, and access to cessation resources will result in a significant decrease in smoking rates among senior high school students. And now, these are the questions that need to be answered in our research post, to be discussed by Ms. Tanza.
Research question. Number 1. What is the demographic profile of smokers in terms of age, gender, and grade levels? Number 2. What are the factors associated with smoking among senior high school students? Like peer influence, mental health problems, and family problems. Number 3. How prevalent is cigarette smoking among senior high school students? And lastly, what interventions are effective in preventing and reducing smoking rates among senior high school students? Research design. The main methodology in this research is quantitative. The research design for the prevalence of cigarette smoking and ways for intervention among senior high school students will involve a descriptive next method design. It aims to provide a comprehensive understanding of a research problem or phenomenon. Quantitative data is collected first using surveys or questionnaires to measure specific variables of interest. Qualitative data is then collected through interviews, observation, or focus group to explore the context and meaning of the quantitative data.
The research environments of this study will be conducted at Pilar National High School, Villahermosa, Pilar, Cebu senior high school students. Data collection will occur in classrooms or other suitable venues in the school. The research team will collaborate with teachers and school staffs to ensure participant safety and comfort. The study will adhere to ethical guidelines and inform all participants of the study's purpose, their rights, and the confidentiality of their response.
Research participants. Research participants for the study are senior high school students of Pilar National High School. For the sampling, non-probability sampling will be used as a sampling technique. Quota sampling is the specific of non-probability sampling that will be used, And quota sampling selects a sample to reflect the proportions of specific subgroups in the population.
Data gathering procedure. Number 1, approval and consent. Approval and consent is needed because data gathering must not be forced upon the respondents. Number 2, selection of participants. It is meant that they are randomly selected of each members. And number 3, distribution of questionnaires. There are two primary ways of questionnaires, the online and offline. And the ways we use to distribute our survey is through offline. Number 4, data collection. It is a systematic process by which observation or measurement are gathered in our research. And number 5, data analysis will be analyzed using descriptive statistics such as frequencies, percentage, mean, and standard deviation. And number 6, interpretation of results. And number 7, intervention of strategies. And lastly, report writing.
Statistical treatment, the levels of measurement that will be used are nominal, ordinal, and ratio with their different univariates. First is the mean, median, mode, range, and proportion. For the age, mean, it is also known as the average, the total sum of values in a sample divided by the number of values in our sample. And the median is the middlemost set of numbers. And mode, the most frequently occurring value.
Range. The difference between the lowest and the highest values. Standard deviation. A standard deviation is a measure of how dispersed the data is in relation to the mean. Low standard deviation means data are clustered around the mean, and high standard deviation indicates data are more spread out. Frequency. The frequency is the number of times a particular value for a variable has been observed to occur. And percentage is gender and grade level.
Thank you for listening.
Question. Are you ready? I would just like to ask from any of the group except Kawayan, Cassie, except Kawayan and Cassie. Now, how are you going to encourage your participants or respondents to truly participate in the conduct of the study, knowing that it is more on smoking? Okay, probably na bata nga, hindi ko participate anak na in denial pa ko nga, smoker ko. So how are you going to encourage them to participate in your research study?
Ang topic would be somewhat
Sensitive siya ang topic dyan ba?
Bawal pa sa school.
How are you going to encourage the respondents to participate in the conduct of this study? Yeah. Si Cassie pa dyan ang president.
Kaya may pinaka-struggle.
Like, answer na, basin na siya yung ito na enhancer na smoke observer.
Siya mismo ang smoker. Saan man yung pag-encourage niya? Dapat participate ko ano na study. Kaya Research G12. Although nindot yung study, yes, but the problem is, how are you going to encourage them?
Mag-ask of permission, sir. Within budget siya, sir. Paano mag-participate niya sa sir smokers in this?
So what if Di jud siya.
Kay mahadlok siya o mindset.
Wala na rin nila man sir, o pili ka ni sir, di ano to.
Nya what if tanan dili?
Wala may participants.
Kay smoking good siya, lisod di kay siya i-encourage yun nga. Kung participate yun siya.
Ang title.
Sir, kung unsay something sir, kung unsay mga side effects ng abot na siya.
So probably the first thing you need to do is to inform mo nga whatever the result is confidential din siya. Yeah. Regardless of the rule na implement sa school, what siya bearing. It's just the matter of for you to participate lang din sa study.
Wala, kay usang pag-work.
Oh, labi na, si Cassie pa siya, President mahadlok na siya, kadinilista ko ani kay kung saan ako sa ilista nila, bantayan nila ang mga fines me. Diba? So that's one of the
Ikaw, Eman, mag-participate ka. Pag ikaw mag-participate doon.
Pwede ang researcher ma-respondin mo.
Pwede. Actually,
Pwede
pwede.
implement siya ng
Pero, as to how I understood the title of prevalence, so you're going to identify how many percent of the population is affected, no?
Yes,
So,
ma'am.
the participants of your study are both smokers and non-smokers.
Yes, ma'am.
To?
Yes, ma'am.
Kay prevalence man.
Yes.
Well, niya, maulang ito, saan mo pag-encourage yun, no? Mag-participate.
How you encourage your informants?
Kanang maghatag mi ka ng consent form nila i-filling ba sila or dili, pero nasa dito utang nga lahi ang policy sa school o lahi sa niya mo kuan sa
Dapat
study.
pa-explain
Dapat
yun,
So
clearly
explain
to
mo
them.
clearly sa mong kanang form.
Kaya kasi yun ang perception ba, mga kanina, pamagi dyan si Sister para
Para identify.
Klaro jud po na mo ma'am niya mo sa iklaro nga ang ilahang identity concealed or confidential.
Confidential siya, di siya pwede
But yeah, as to how they will respond to the questions in the questionnaire, whether truthful with you ka or dili.
Mo na yung mo threats po na naman pero ang ako lang sila kuhawan ang more common jud na ilahang mga tubag kay kami po na may mga sa panayanan sa balay magnapon may mga factors dito nga na manigarilyo na mo niya makaibaw po ni sa ilahang mga actions ingana kung sa ilang mga reasons.
So in selecting your informants, will you conduct a survey every grade level?
Dili nga self-administered questionnaire lang pero kanang dili ra sa senior high school students niya but of sa ilang age ma'am dili ra man kay 16 or 17 to 18 kay na may mga dagko na
Unlike din na
Grade 7 to
grade
grade
7 to
12,
grade
yan,
12.
year
Kaya
11.
kay sa grade senior high magulo.
Kay
Kaya
mostly
mga
siya
mga
man-
mga 20 plus na ato.
Which is okay po.
Okay po siya i-include. Sunod. Dirita sa, skip na ko kay okay naman ang other parts. RL, okay ra theories.
No problem.
Yes, no problem. Arita sa research participant. Wala since ang inyong participants are all senior high school students, wala ninyo i-identify ang total population in your sample size. Nag-quota sampling mo, pero how many?
Kanang wala po ni naka-start day anak ma'am.
Pero since most man, tanan man senior high school students are different
By
whether
section.
oh, pero the number ba? So, pila man tanan senior high school?
Diri
Almost
pila
200
tanan
plus?
ka.
O niya sa 200 plus, pila ka
Pila ka
sample
ba?
size? Pila
Wala
ka
ang inyong
Okay, so wala mo yung sample size na i-indicate ha?
Thank you ma'am.
Sa mga na-high school lang.
Hypothesis po.
Mm.
Dili, okay na siya pero now man din yung age did no denoted by kanang age man din. So pwede ni implementing a school is tobacco prevention program that includes education on the risk of smoking, skills for reducing peer pressure, and access to cessation resources do not have a significant impact
Kay naroon dyan ta.
in decreasing smoking rates on senior high school.
Thank you sir.
And then, mahog kanang two-tier yun di siya nga study, no? Kaya after knowing the prevalence, ang factors reasons, you will look for, mag-implement siya sila intervention. Kaya ingon man di rate.
Yes,
Kaya mo man yung output
Oo,
ko
yun
na
yung
na yung kuan.
ma-decrease
Yes, buhaton sa siya, oh. Kay mo may inyong
Include
Ang
siya.
informe sa school anak.
Yes.
So yung significance of the study, diba?
Ito.
Seryoso situation
So,
na study.
tanggalan ng number, label, siya, ete, and that.
Okay, ma'am. Thank you, ma'am.
Pati yung definition of terms.
Yes, ma'am.
Ang inyong significance of the study, kung ini siya school administration. Kaya mo panagbiyan mo kayo sa inyong mga
Ma'am. Thank you so much, ma'am.
School administration. Dahil yun. Arita na rin napita sa statistical treatment.
Ako na.
Sige. O, diri sa inyong, the data gathering procedure, ito na, are you going to collect the data? Pero yun naman, add mo diri on how we're going to analyze the data, interpret the result. Pero, nabother ko sa chi-square sa details sa ano ba? Sa mga kasagang Oo, kasagang sa chi-square details, ano ba? Magano ba ta? Mag-square ba?
Ayun. Hindi ko anong good ma'am. To be honest, dyan ma'am, no, wala dyan ko yung idea about ng statistical treatment due po na itong pandemic. Mo to nakita kog laing sources kung saan ako pagkuha ng mga data. Sa una mo na ako
Pero since, yes, I understand. Okay, kanang dihang kapita, sige, tabangan sa din mag-discuss kung paano sa
Thank you, ma'am.
treatment. Okay, di naman di naman siya cover, di naman siya cover na sa...
Wala
di
buhay
naman
ako ah.
Dili naman po siya cover sa practical research, ma'am. Kaya prerequisite man sa practical research ang lahat.
O bitaw.
Oo,
Uli, kaya
prerequisite man.
face to face siguro lang.
Dili man.
Mo to
So,
nag-research din.
kaning ang nakaya rin sa mga is descriptive stat na gutom kaya di harap ko confident. Pero actually, I have basic knowledge on inferential stat pero kanang magtuon pa sa jud ka ba para ma-explain mo kanang on choosing the right statistic. Yes, masagot ito. Mo lagi nga kung kita sa ato ang part makagamit ka but how are you going to explain it the simplest term possible? Kana jud diha problema so magtuon pa sa ako ha.
Yes,
O,
ma'am.
sige,
Thank you so much, ma'am.
Given the title nga, given your research design nga kanang descriptive survey mo, descriptive mixed method kung descriptive lang ya univariate di man mahog nga bivariate yun mo kay intervention man ang
Yes,
sa
ma'am.
univariate raman siya statistical descriptive stat rin mo ko to
Sige.
hindi mo
Thank you so
maka-inferential
much.
given your research design.
Ano ba? Yes,
Wala
ano
na-
ba pag yung question? Questions pa yun. Yes or no?
Ay, pero, wait, posible, pero dili sa damag-an mo ba ha?
Daghan
Kung
siguro may
masalit sa
answer.
question.
Pero,
Pero,
yes,
yes,
respondents, ma'am.
pero given your problem, ba, dili mo siya, pero hindi rin na yung pag-test on to effective ba siya ang intervention.
intervention.
Kana.
Okay.
Ay,
Di siya siya.
ah,
Di siya referential. Labi na,
Di
question
siya.
mo.
Okay.
Yes or no?
di siya, wala ko tayo inferential stat ha.
Thank you, ma'am. Thank you. Thank you, teacher.
Yeah, dili ba ka nang asa na mo magkuha og terms kay define?
Terms nga may pag-define.
Oh, asa man niyo kuhaon na ang mga terms?
Concept ko define mga teacher. Kaya tag-google.
Di ba ka nang asa sa part sa inyo ang kuhaan? Ay, kanina word mo niya kanya appeal sa akong definition of terms.
Ganun sa among title, teacher.
Yang ano na appeal si peer influence.
Oh,
pero
bitaw.
ano yung
Isa
appeal
po
si-
ang good na sa RRL ng
Kita ipahimong ka tayo si peer influence.
Oh, niya, wala yung appeal ako ba nga factors
Mo
hindi
lang
sa
mo.
mga SOP.
Kaya siya.
Thank you.
Ya, kanina. Kaya what are the factors associated with smoking among senior high school students? Peer influence, financial problems, family problems. Kasi siguro mapil sa lang yung personal problem.
Mental health problems, yung teacher, wala na ako na-edit. Wala na ako na-edit.
Kaya ang other factors pa yun.
Ah.
Mo reflect ba na sa inyong questionnaire? Tanaw na to.
Personal problems or mental health
Mental
problems.
health problems. Kana, Jo.
Yes, ma'am. Ako dito na wala na ako na-edit.
Ang formatting na lang sa inyong questionnaire. Kaya
Yes,
sa
ma'am.
dili ra man necessary mag-double space if the actual questionnaire na yun.
Basig appeal sa dili ang academic pressure.
Appeal na po siya
Ah,
sa
sa mga
RRL.
personal tingan.
Oh, sa personal ba? No?
Sa mga sa mental.
So you will craft a question nga
Yeah.
About
mo
Specific,
fit ang sa
specific
personal
na.
problems, specific sa mental health, specific sa
Specific sa
academic
academic.
pressure.
Okay, thank you, teacher.
Thank you, teacher.
So far na okay, educating ha. Super clean. So, di na lang ko manghilabot aning uban nga RRL nga 2009 pa, 2007, sige na lang.
Wala. Basta to? Nag-chat lang ko ha.
Maganda na lang yung facing
Kaya nag-ibahang yung kaya ako 10 years, imbis 5 years na unta. 10 years, 2013 up.
2009.
Ay, 2009.
Kasi 2019.
2009, tingin ko lang siya. Videos mo. 2016, 2017, sige na lang. At least you know how to ka ng craft ba. Ang importante lagi, ang skill niya, iba kung mo.
Nagsilipan, ibalik ko. Oh, sama dyan different ka. At ibalik. First draft. Sunod second draft. Oh, sama different.
Makita na sa TikTok, mga tips sa YouTube, isa kasi.
Actually, videos, pwede maging siya.
Yes,
Pwede.
naghan dyan mas masada.
Mas masabdan. And the APA na karon nga expanded edition sa APA is not limited to written RRS. Na i-video na how are you going to cite in video na
Panan na.
Panan
Everything
na,
is provided.
everything.
Yung gabi ka bukas yung mga output ko eh.
Lagi
Wala ka sa'yo nag-isip pa.
Grabe
Reduce
naman.
prevalence of smoking among
Ibilang.
senior high school students. Improve attitudes and behaviors towards smoking. Increase awareness.
Kani hopeful sad ko sir nga kani siya is until
Implement dyan nito.
i-implement until sa next nga mga 4 years pa. Ibilin dyan ninyo sa next ka SSG.
Yeah, pwede sad mo nga after this, maka-formulate mo o kanang rule or law sa SSG regarding about smoking. Para ang sunod na school year, nara sila yung buhaton, kung sa ilang buhaton, ani kung tayo mag-smoking na sila. Kailangan dyan gihapon na until now.
Naadyo mo lang. Lagi ko na kasama kagahapon kinito sa clinic. Sama dyan ang buho niya na may second dito. Muta ko i-chat, grade 9 ng saysay. Kandiha dyan na ni Garilo Sudza.
Wala gabi na siya pakita.
Grabe na lang.
Ako na mo po nila nakapa-inspire ng mga mag-conduct siya ng mga studies mo.
Kinakalay ko kos niya sa
So, ano mo ka na ninyo gibutang diri kasi nga na-inspire man dahil mo. Daghan kaayo, pero wala mo
Acknowledgement
pa.
na lang. Thank you so much to the smokers.
Sige na ay.
Sige, oh.
Thank you so much, teacher.
Congratulations in ambisyon na tawag po pero nindot siya.
Nindot si Tacho.
Thank you.
Congratulations!
Thank you, ma'am. Thank you, sir. Thank you, ma'am.
Sige, dalhan nga. No worries.
Goodbye.
Bye.
Bye, teachers. Thank you, guys.
Bye, Grace.
Bye, ma'am.
Ma'am.
Wala